Hi, I am Christy Musser, and I'm a senior telehealth consultant with Blue Cirrus Consulting. Today, we're going to talk about rural health coding and billing for telehealth services. First, just want to mention that Virginia has really stepped up, and this was in an article recently that Dr. Karen Rubin, director and co-founder of University of Virginia Center for Telemedicine, assured us that when the public health emergency ends on May 11th, just right around the corner, Virginia will not fall off the telemedicine cliff. But what does that mean specifically for billing and coding within the rural health center and telemedicine services? Let's find out. So coding and billing post-pandemic, I just want to briefly go through and remind everyone just for a spot check, what are the permanent Medicare changes that we can count on, and what are the extended flexibilities, which are a good year and a half out, where we can continue to provide telemedicine services. So the permanent changes are around the mental health services primarily. There's no more geographic restrictions, no originating site restrictions, meaning the patient can be in their home in any location as far as address, does not have to be a rural area. Audio-only platforms will be acceptable for mental health services. We do recommend that you still document the patient did not have the technology, or they chose not to use video as available. Also, FQHCs and RHCs can continue to serve as originating site on a permanent basis for mental health services. Now, that is with a one in-person visit within 6 months of that first visit and annually thereafter. And then finally, virtual communications will include virtual check-ins and remote evaluation of images under the current HCPCS code of G0071. So then we look at extended flexibilities for a good year and a half through 12/31 of 2024. The geographic and originating site restrictions will actually be for all telehealth services that are approved on the Medicare list, which we have that reference for you. That in-person visit within 6 months will not be required at this point in time. Audio-only platforms, again, will be acceptable for any approved telehealth service if the patient does not have the technology or chooses not to use it. Again, we recommend you document that. And telehealth services can be provided by an extended group of providers, that physical therapist, occupational therapist, speech language pathologist, and the audiologist. And then you can actually bill for digital online services as a part of virtual communications through the end of 2024 at minimum. So what does this look like for Medicare on a Medicare claim? For your non-mental health services, you're going to use the rev code shown here and the HCPCS code G2025. That code will represent any virtual service, whether it be an office visit, transition of care, or preventative service. Whatever the service is, you're going to use that code. You will be paid $98.27 in 2023. 95 modifier is optional. The CS modifier you will want to use when the service is preventative, and you want to indicate that cost sharing should not be applied to the beneficiary. For mental health, you will use the 0900 mental health revenue code and the appropriate mental health HCPCS code, and the CG modifier is what you would use. The payment rate will vary depending on the HCPCS code, the appropriate HCPCS code you use for the service. The cost report, make sure that you are reporting out the originating and distant site costs for telehealth services on the appropriate form listed here in the worksheet A, cost other than RHC services. And again, there's the telehealth services calendar year 2023 link, so you can see all the approved services that will be in play through the end of 2024. Virtual communication services, the G0071 code, there will be a payment of $23.72 for 2023. And what does that include? It's that virtual check-in. A patient calls, has some questions, maybe a few changes are going to be made, but it's a quick, anywhere from 5 to 20-minute discussion on the phone. You also have the evaluation of recorded images or videos. Someone sends a picture. That will be continue to be covered under this code. And then your digital online evaluation services, which is an asynchronous communication in a secure platform, probably your patient portal. So patient has a question. It can be structured or unstructured, but the documentation does have to demonstrate that medical decision-making and an assessment was completed by the provider. And you can see there the various codes that it would incorporate, and that would all be under that one rate of the G0071. Moving on to Virginia Medicaid. Virginia Medicaid is covering rural health services. You may act as distance site or originating site, and you will bill under the encounter rate methodology. Indian healthcare centers, including Indian tribal clinics, may also act as distant site or originating site and will be part of the all-inclusive rate set by IHC. The revenue codes are listed there for the Medicaid billing. Finally, for your commercial payers, you want to check often, probably more often than you do for regular coding and billing updates. The things you want to check are listed here. That's going to be your policies, what's in the policies, the CPT and HCPCS codes, the revenue code updates, modifiers in place of service. Those are continually changing, updating based on the payer. And if the RHC, if you are an RHC, you want to find out, can you still act as the distant site with that payer, if that's the methodology and payment and how you're reimbursed, and also check on your the changing reimbursement rates and updates. But wish you well. Virtual care is here to stay. There's some references for you. And if you have any additional questions around coding and billing, Blue Cirrus Consulting is here for you, and you can reach us through our website or through our email. Thank you.